annual public board meeting is a mandatory requirement outlined in the second schedule, clause 12 of the RHA Act, which requires the Regional Health Authority to hold an annual public meeting to review the authority's performance in the preceding year and share its goals and targets for the current year. In alignment with our strategic plan, Transformation for Excellence 2020 to 2023, I am pleased to provide for your consideration several significant undertakings which no doubt redound to improve patient services. Re-engineered the surgical services to include a fully automated surgical waiting list management system and strengthened the pre-OP assessment clinic, which reduced the number of surgery cancellations. While significant resources were fixated on containing the pandemic, coupled with the vaccination exercises at the mass vaccination sites, health centers, and community road trips, the strategic goals enunciated for the transformation to excellence were always a priority. As a result, an average performance rating of 73% across the 6 goals were realized. Additionally, institutional strengthening activities accrued to 50% completion, whilst the average quality compliance was 90%. It is with this in mind, the board in 2022-2023 is looking forward to the following priorities being addressed, since they are aligned to the achievement of 6 strategic goals and will positively impact on both patients and staff. And these are our projections. 1, improving the workflow coordination and accelerating specialty skills training of nursing staff in the emergency department to improve care delivery. A full rollout of the care program, establishment of the health promotion unit, and the introduction of coherent health promotion strategies in support of the TT Moves initiative. Introduction of the adolescent health and men's health programs to prevent NCDs and decrease morbidity. Strengthen the home visiting program by adopting modernized approaches, including technology, to improve home health care and reduce complications. Maximize the operations of the community liaison unit to improve discharge planning, the referral system, and tracking of clinic and other defaulters. Comprehensive review and remodeling of the Department of Medicine to include the full rollout of the stroke unit. Review and expansion and reorganization of the oncology services to address current patient needs. Introduce operationalized technologies to improve cardiac, gastrointestinal, and neurological services. Improve the laboratory and radiology systems to improve timely response and support for high-risk patients, in particular, those accessing care at SWRHA. I'm on to 11, there are 13. Accelerate systems for achieving the International Baby-Friendly Accreditation Certification. 12, to reintroduce the Quality Awards Program to support continuous quality improvement initiatives and innovations and recognize staff for their contribution. And last but not least, to initiate a project of beautification of the San Fernando General Hospital campus. Ladies and gentlemen, at our October 2021 meeting, I stressed that healthcare modernization and transformation with a cohesive team was necessary to improve the SWRHA. We reiterate this commitment with the appointment of one new board member who recently joined the team, Director Ricky Barrett. I also wish to express the board's sincerest appreciation to the former Deputy Chairman, Ms. Giselle McFarlane, for playing a pivotal role in transforming our financial systems, and wish her success in her new endeavor. As a board, we continue to appreciate the unwavering support of our Minister of Health, the Honorable Terence Dialsing, and the ministry's technical team. Today's public board meeting solidifies the importance of engaging with all our stakeholders along this journey of transformation, since we rely on your feedback in order to strengthen the continuum of healthcare and increase public awareness on issues affecting the local southern community.
Noting strategic goal number 1, the first of the 6 pillars, which is to improve the patient-client experience and outcomes throughout the SWRHA, including secondary, tertiary clinical care excellence. First picture indicates that the SWRHA has made improvements to wait times in the emergency department, San Fernando General Hospital specifically, for patient admission times to an inpatient unit. For the period under review, 96% of patients who were admitted were warded within 24 hours. It also shows the remote filling of prescriptions and the extension of pharmacy hours continued during the period to accommodate patient convenience, whilst the last image shows and depicts that the patient's accessibility to healthcare services were inevitably affected by the pandemic, which resulted in 57,117 telehealth consultations being conducted in order to maintain the follow-up of patients for the period under review. Patient experience remained a priority, even when face-to-face contact was not possible, especially in the outpatient and primary healthcare clinics. Undeniably, COVID-19 impacted our service delivery. For some months, non-urgent services, for example, elective surgeries, were curtailed to respond to increasing pressures on acute services. This decision, while necessary, impacted several of our clients and resulted in an unavoidable inconvenience. However, these difficult decisions allowed the health system to provide critical care to an increasing number of confirmed COVID-19 positive patients and reduce the risk of the capacity being exceeded. As we reimagined and re-engineered to improve our overall delivery of care, we implemented new pathways of care for COVID-19 and non-COVID-19 related services. We increased hospital capacity, we resourced community services, we adopted technology at an exceptional rate. Although this was all catalyzed by COVID-19, these changes are aligned with our long-term strategic direction. Reporting on strategic goal number 2, decreasing clinical and corporate risk throughout the SWRHA by improved governance. We are pleased to report that the past year highlighted the importance of fast, decisive action in responding to the pandemic, while still doing all in our power to mitigate risk to our patients, staff, and the general public. During the period under review, work continued to further enhance governance arrangements, and the established executive-level oversight committees began implementation of key transformational programs, projects related to the operating theaters, committees that dealt with issues of cost savings to the authority, patient safety, business communication, and human resources.
The SWRHA is pleased to announce the launch of its Quality Awards program, and I am here to present an overview of the program. At the SWRHA, we promote care, compassion, and competence, and we believe that the Quality Awards program allows us to demonstrate this commitment. This program is mirrored from the Ministry of Health National Health Sector Quality Awards program, introduced in 2003. We have tailored the award to allow us to address the areas of deepest concern of our valued clients.